afternoon, everyone. This is Jessica McKnight, the Administrator of McLean County Health Department, and we're here to provide a community COVID-19 update. We're joined by representatives from both of our local hospitals. Today, McLean County Health Department is reporting 136 new cases of COVID-19. That brings our total of probable and confirmed cases to 7,809. At this time, 1,355 individuals are isolating at home. We're reporting that 6,381 individuals have been released from isolation and are at this time considered recovered. More than 133,000 tests have been resulted for a cumulative positivity rate of 5.9%, and our rolling 7-day positivity rate is at 8.1%. There are 23 McLean County residents reported to be hospitalized at this time due to COVID. And it's important for us to remember that that number does not represent all individuals hospitalized for COVID or other treatment and care. Our local hospitals provide care for individuals from outside our county, outside of our state, and currently reported over 50 individuals are currently hospitalized in McLean County for COVID-19. Our hospitals are also reporting 91% of ICU beds in use and 83% of total beds in use. Today we're saddened to report that we have received notification of the 50th, so 50 COVID-related death, a female in her 30s with underlying health conditions who was not associated with a long-term care facility. Our thoughts are with all those who have been affected by this virus, and we remind the public that these are more than just numbers that we're reporting out daily. These are members of our community, members of our families, our friends. No one can guarantee whether they will have mild illness or serious complications due to COVID-19. People of any age with certain underlying medical conditions are at an increased risk for severe illness from COVID-19, but even young, healthy individuals can have complications from the virus and sometimes need to be hospitalized. Our priority now as a community should be what each one of us can do to help save the lives of our neighbors, our families, and our friends. So thinking to what smart choices we can make to help slow the spread. And at this time, I'm going to turn it over to our representative from OSF.
Hi, Jessica. Thank you. I just want to take the opportunity to really encourage our community to come together, both for each other as well as for our healthcare team. Wear your mask anytime you're with anyone outside your household. Keep your distance. That 6 foot plus provides a little bit of a barrier. And last but definitely not least, really asking everyone to rethink their Thanksgiving plans. It's not too late to make a change. Really the safest option this year is to stay home and celebrate with those within your own household. Me personally, we had that very difficult conversation. Normally, we would go to my sisters, my parents would be there. And I talked to my sister a couple weeks ago and I said, I just don't feel comfortable doing that. Our parents are aging. And I look at my dad especially because he has underlying health conditions and said, if my dad catches COVID-19 and he becomes critically ill, today I can't say that we have a bed for him here. So where would my dad go? Where would he be able to get care? And that's the kind of thought we really need our community to think through. Who around your table is at risk and who may be at risk that you don't even realize it today? Because those are the individuals that will either be in our ICU or in Colleen's. And so we're really asking on behalf of our teams to, take the time out, celebrate virtually, still talk to your family, still connect with them, but let's provide some distance and give this pandemic time that it can wind down. We're in kind of the home stretch, we hope, as we're looking forward to several vaccines. If we can get through the next few months and keep as many people healthy as possible, that really helps all of us. And really kind of feeds into my second request is to think about staffing. There is definitely a strain with our healthcare teams. They've been doing this for over 8 months. And now we have this surge. And I've been asked by several people, well, what are you going to do when you run out of staff? And said, staffing is a finite resource. There isn't a truck full of nurses or techs or physicians just waiting to come in. At the beginning of this pandemic in March and April, we saw the surges in our very large cities. You know, we had New York, Chicago, and LA, and we were able to send staff to those places to help. You know, here at OSF, we sent several of our nurses from here at St. Joe's, went up to our hospital in Chicago and helped with the pandemic. Well, today, every hospital in the country is handling the surge. So there is no extra nurses anywhere to come in and help us make up the difference. So it's really important that we're able to preserve our healthcare teams, and I'm talking collectively throughout our community, protect them to the extent that we can. And when you mask, when you stay at home, that's really giving them some ability to be able to recoup and take care of those we have and prevent future surge. So thank you, Jessica. I appreciate the time.
All right, and we also have a representative here from Carl. So just a few minutes here to go ahead and talk. And just a reminder for everyone that this program will also be recorded and put on the McLean County's YouTube page. So if individuals are missing it currently, so they can go back and listen to it later.
Thank you, Jessica. So hello, everyone. I'm Colleen Canada. I'm the president at Carl Roman Medical Center and with Carl Eureka Hospital, and just appreciate the opportunity along with Lynn to be able to be here as we come together really from a community and even a regional perspective to have this conversation today. I would like to start by just even really reiterating the sense of urgency that we are feeling right now from a healthcare perspective, and really implore upon all of you, as Lynn did such a great job stating, and really asking for your help and support right now. We are truly at a critical fight against, we're truly at a critical point really in our juncture against our fight against COVID. And specifically, we are continuing to see increased hospitalizations along with increased patients in our intensive care units. As Lynn indicated, much higher than what we saw in the spring. In many cases, in fact, our numbers are double right now of the peaks of what we even saw, and those numbers are continuing to go up on a daily basis. The other thing that I think is helpful to note is back in the spring when we were in our first fight against COVID, and we didn't experience the numbers here within our region like they did up in Chicago, we had also at that time closed down the majority of our outpatient practices. And so as we looked at our plans to support growth of inpatients and growth of intensive care patients in the hospital setting that actually never materialized at the time, we had excess staffing in place to be able to pull in from those ambulatory settings to be able to supplement and help our bedside nurses, which thankfully at the time they were not needed. We're now at the point where, with the community back open and with the need in the outpatient setting for our ambulatory staff to continue doing the work that they're doing, we don't have the extra resources on the inpatient side. And in addition to that, as we talk about our staff being affected by COVID, that takes those individuals out of play, which decreases then our ability to really have staff by the bedside. So again, it's really calling upon all of us to do our job. A couple of things that I want to note that we continue to talk about. You might have heard that there are hospitals even within our own region, but definitely throughout the state and the country, that right now have moved to defer some inpatient elective surgeries. You might recall back in the spring, really, we were mandated to shut down all elective surgeries, inpatient and outpatient. Thankfully, we've been able to ramp that back up to provide good, safe care for those that need it. Right now, we're at a juncture that there are hospitals in our region, and we are not one of them, but there are hospitals that are deferring elective inpatient surgeries in order to be able to free up and maintain bed capacity to care for those that need our care. And so We have a number of initiatives underway. I want to reassure everybody we are doing our part to make sure if we ever got to the point from a safety perspective that we needed to look at deferring inpatient elective procedures, we certainly would. We are not to that point right now, and we're working on a number of key initiatives to be able to keep bed capacity open. So some of those initiatives are our COVID at Home program, where patients from the emergency department who are on the verge of maybe needing to be admitted could be managed safely at home with a support from our transition team. We're working on earlier rounding to be able to discharge patients earlier in the day that are going home to free up bed capacity. So we're working on a number of initiatives to keep our beds open. But it's important to know that we very well could get to the point where, from a state perspective, the governor does move to shut down elective procedures. We're working very hard to maintain capacity so that that doesn't happen. And we're really imploring that we're working within our own communities to make sure we've got the ability to manage that ourselves. But I want to reiterate what Lynn said, and that's that our staff are completely, they have been stressed by the events of the last 8 months and in caring for COVID patients. Not only the physical well-being of them, but also the emotional toll that it's taken when you talk about the number of individuals within our respective organizations that have passed away. Jessica, to your point, every one of these individuals is a human being that is cared for by our staff and has a family that our team members get very attached to, and it becomes very emotional. So not to mention, as staff get worn down or as they come in contact with others out in the community that are COVID positive, our staff are also getting sick in their own way. So it is continuing to put a strain on our resources. So that really gets to my point of just saying, you know, as we go through the holidays, and it's not just right now for Thanksgiving, what I'm asking is going through not only Thanksgiving, but the normal Christmas and holiday celebrations that Christmas, Hanukkah, whatever faith tradition you might celebrate, what that looks like for you. We're asking that you keep it within your own immediate families and not go back to large group settings. I think about what we can do this year in 2020 is very different. It looks very different than what it's looked like the whole year has in past years. This too will pass. We will get through this. We will have a vaccine. We will come out on the other side of this. But right now we are asking for all of your help and support in really staying home, thinking of unique and creative ways to do a Zoom cocktail party or a Zoom dessert or some kind of Zoom activity with your family members that you can't be with. And I also think about what's the ways you could go out and support a local restaurant to get takeout that would be very beneficial for our community and for the restaurants, along with maybe bringing that meal home over the next 4 or 5 days and just having it within your own families. And I guess the last thing I would say is, you know, early on, we all thought we had the safety in our own bubbles, that we kind of that group of friends that we were safe hanging around. And with so much community spread right now, our bubbles are not safe. And I think many of us have experienced that in our own ways, that, you know, it's hard to know who's walking around with COVID or who your child or your spouse might come in contact with and bring into your own home. So the more that we can really continue to contain who we're around and keep our bubbles very small and very intimate, the better we will be right now. So thank you for your support, for Jessica, the wonderful work that you and your entire team are doing. I know the strain and the stress on the health department certainly has been unprecedented this year.
So thank you, Lynn and Colleen. We have some time now for questions. And if you are asking a question, if you can give your name and your affiliate, that way we have that on the record. So with that, we'll open this up for questions.
Lynn and Colleen, Paul Swyke with the Pantograph. If each of you could detail for us what you will do if the hospitals do fill up. I know we've talked a little bit before about your surge capacity plans, but if each of you could enlighten us as far as what would happen if you do reach that 100% margin.
Hi, Paul. Yes, thank you. And Colleen did a nice job of kind of articulating that in her comments, and very much the same. You know, we have not canceled any of our electives as of today. We've been able to continue with those because while we call them electives, a lot of times those really are necessary procedures or surgeries that many people have been waiting on. But if we have to, for safety, we will cancel and postpone those to make space for patients that are coming in that are of critical need. We did open a COVID unit last week we closed our transitional care unit temporarily and using that space as a distinct medical COVID unit. And so we have been able to increase our capacity by doing that. We continue to work with our sister hospitals and where some of them have capacity. You know, for example, St. James and Pontiac, you know, if we have critical patients coming in and maybe we have a medical patient that they can take care of. We don't like to do that to patients and families, but if we can, so that we can continue to care for more people, we will do that and continue to do that. And then very much like Carl Broman, we do have our acute COVID at home program, which has been very successful in keeping a lot of patients that are very ill but not in need of medical procedures, that they're able to stay home and be monitored through that program. So those are a few of the ways that we have really tried to expand our capacity so that we can maximize both the space as well as the human resources that we have within the hospital. Thank you, Paul.
And thanks, Paul. I would just add to what Lynn said, a number of other initiatives. We obviously have our incident command teams that are continuing to meet on an ongoing and an escalated basis in this day and time. And as a part of that, we've got multiple levels to be able to continue to pull the different levers as patient volume goes up. And what I would also say is it fluctuates by the day, by the hour. I get reports 4 times a day pushed to my email with our census and our bed capacity on every unit. So we're managing, right? A number is a number just for the moment because of the fluidity of our patients. But we also have the ability to double up rooms in many cases where we could place more than one patient in a room. We've not yet had to do that. We've got the ability to look at not only within the walls of our hospital, but if we needed to expand to another level over to our medical office center, we've got the ability to expand over into that area. And then we've got plans that if we need to look at, as I mentioned earlier in my remarks, in the first wave back in the spring, as we shut down the ambulatory practices, we had the ability to pull staff from other outpatient areas into the inpatient setting as extra pairs of hands and extra nurses to provide care at the bedside. That would certainly be another lever that we would be able to pull if the volume got to the point that it necessitated that. So we're a long way from that. But again, I would go back to what Lynn said really early on, is that probably it's less about the bed space. It's really about the staff availability right now. And I think we're seeing that across the state. And Jessica, you might even be able to comment on, from a state perspective, but that's really what the limiting factor we're finding is the staffing component.
And this is Eric Stock from WGOT. A follow-up on that for both Lynn and Colleen. I guess first for Lynn specifically, you mentioned the COVID unit going in place. Can you indicate how many additional beds that does afford you for COVID patients?
Yeah, it gives us between 11 and 12 beds. One of the areas is a little small, so we'd like to be able to keep it at 11 or fewer.
Okay. And as a follow-up to that, so it sounds like based on the percentages that we get for hospital capacity for beds being pretty low, it sounds like there are additional beds sort of built into that as needed. Even if you get to 100% capacity, there are still additional beds that you can sort of create within your own facilities before you would need to, find facilities beyond the hospital wall, so to speak, if we're characterizing that correctly?
That is true, but again, what I had shared and what Colleen just shared is an important point is staffing is still an issue. And there is a finite number. We, like Carl Broman, we have a lot of staff that work in the ambulatory space, and they've actually, many of them have already volunteered and said, hey, if you need my help, I'm happy to come over. And they can help and they can task for us, but it is important to remember there's a limited number of nurses that are competent to truly provide RN level care in the ICU, as well as medical care on our medical unit. So while we can pull staff from other areas to come in and task and kind of spread the team out a little bit, it is a finite resource. And that's really why we're leaning on everyone heavily to say, you know what, there may be some grace in there, but we really do need everyone to take this seriously and to take precautions in their own homes.
And could I just add one thing to that? What I would add is, as we talk about bed capacity, especially in caring for COVID patients, the probably one of the most important things that we're asking is, right, we as hospitals are set up to be able to treat patients that come in with heart attacks, with strokes, motor vehicle accidents, other trauma related. And the more patients and resources that we divert to care for patients that need to be hospitalized or in the intensive care unit for COVID takes away the resources that we're able to provide for those individuals who truly need us from those other areas that I just mentioned. And that also is a very concerning part that all of our communities should be concerned about.
You know, and that's, Colleen, that's a really good point because, and I'm sure that you're seeing the same thing, because of the shutdown, if you will, of electives, we have seen an increase in the number of strokes, an increase in the number of heart attacks that are coming in. And so those are people that, whether they purposefully delayed care or they did because whether their appointment with our cardiologist or what have you was put off or done differently, we are seeing an escalation in those patients today. And that's another reason why we're trying to push and keep as many electives and ambulatory care as we can, because we know that that is not good for patients either, because those patients truly need care, that we can't put off everything because we're in a pandemic with COVID-19. Thank you.
And this is Eric Stogg at WGLT again. So looking at staffing, do you have enough, question for both Lynn and Colleen, as based on the number of patients you have now, do you have enough staffing to be able to give each of these patients the care and attention they need? Because we've heard early on in the pandemic stories nationally about there weren't enough staff members to truly give them an adequate level of care. It was just sort of triage. And how close are you to reaching staff capacity where they are completely maxed out?
So Eric, I would just start by saying the answer to your question is, do we have the staff today that we need to care for the patients that we're caring for? The answer is yes. What I would also say to you, though, is you've got to remember that we staff in 4-hour increments based on volume changes, acuity, and staffing availability. And so it is truly fluid when you look at how significantly our census can fluctuate from hour to hour, or even in 4-hour increments. And the concerning part that we can't control, and this is again why, with such widespread community spread of COVID, more and more of our staff members are becoming infected. And as our staff members become infected, that takes them out of the work pool and takes them away from the bedside for, in many cases, up to 2 weeks. And that's where we start seeing the strain, or asking staff to pick up and work extra shifts, which certainly they have done and they will continue to do. But there's a limit to, from a safety perspective, and just their mental and physical well-being, how much we can ask them to do. So it's a complex answer, or it's a complex question, and not one I think that's easily answered.
And I would agree with everything that Colleen just said, and that's exactly correct. You know, today We are providing excellent care for every patient that is here and is coming through our emergency department. But it is. Yesterday when I left, I looked at our capacity and thought we had a little bit of breathing room. And then this morning I checked the census when I got up and I looked at it and I'm like, oh, wow, we had a very busy night in the ER and a lot of very sick people coming to us. So it can change really on a dime.
Paul Swyk with the Pantograph again. I have a question for Jessica. Jessica, I know something we've talked about before that I wanted to come back to again, and that is, what would the county do if the hospitals filled up and they came to you for assistance? What would happen?
So we've talked about it a little bit before, Paul, but alternate care sites is something, in an extreme situation that we would work with our hospitals to set up. And the alternate care sites traditionally are used when there's an emergency, like a tornado or an earthquake, where you're providing that basic care in those situations. So it's not to treat COVID. That would still be done in the hospitals. But again, like Colleen and Lynn have both said, the concern is we could set that up if needed, but we would still need people there to work that. So we would still need healthcare professionals. And that's what is very concerning for us, is that, we're prepared to help our hospitals with those resources, continued if PPE is a need, but it's healthcare professionals that across the state and across the nation that we're seeing a desperate need for. They're exhausted from, working these last 8 months just tirelessly. So again, we're prepared to be able to help if need be in that extreme situation to set up an alternate care site. But again, we would still need healthcare professionals to help to work that.
And this is Eric at WGOT. Following up on that, how close are you to needing that facility, to needing a separate site?
I think we are not. I just want to make sure that we're all very clear. We are asking for the community's help and support to make sure that we can bend the curve right now. We're at a really critical juncture, and we've got the opportunity, and I believe the governor's tier 3 mitigations, as much as they're not necessarily liked by anybody, send a very strong message to all of us that we are at that critical juncture, asking everybody to really do their part right now so that we don't end up in a situation where we're really scrambling from a public health perspective, looking at alternate sites of care.
And I would agree with that. We're not there today, but we don't want to be there, and we don't want to get there. We want to be able to take care of our patients, but this is just where it's really critical, because what we see today is really what we will experience in 2 to 3 weeks from now. Those patients will then start coming into our ER, and then 2 weeks later is when we'll see patients coming back into our ICU, and that's what we've seen with every surge from COVID-19. And so it's really important, as we're seeing our census spike today, that we start getting this communication out so it does not continue, that we're truly able to level off and decrease the amount of spread within the community.
And this is Eric at WGLT. Going back to the staffing issue again, the county, I guess at the start of the pandemic, had been building up a roster of healthcare professionals, sort of a volunteer reserve, if I'm characterizing that correctly. And I guess at the time, the thought was they could help with, vaccine dispensing and that sort of thing. Would a group such as that be able to play any role in helping in this time if staffing gets to be too difficult at this point?
I believe you're talking about the Medical Reserve Corps that we work with. Yes, and we have been communicating with them throughout this pandemic about potential needs for them, and they have helped us even at the health department with a few things that we've been doing. Oftentimes they are also retirees, and so potentially in that most vulnerable group. So we have to keep that in mind if we're looking at what they could be used for. Also, Medical Reserve Corps members don't always have to be medical professionals. That's something that anyone can volunteer for. And so, individuals may not always be in that, still, up to date on licensing. And so, is that something that could be used? Again, I think we're talking in a pretty desperate situation that we might look to them to help, but, they have other uses that we can look to them for.
Jessica, Paul Zweig with the Pantograph again. The county's positivity rate has now been declining for several days. I know we talked about this a little bit last week, but can we now identify this as a positive trend, or is it too early?
Still way too early, Paul. So, obviously we like to see it going in that trajectory, going downwards, but, 8% of, I think, we had 12,000 labs done, 12,000 COVID tests done last week. 8% of that is still a pretty significant number. So we're still seeing, over 100 new cases added to our total each day. So there's still a lot for us to do, but, this shows this community buckled down, a couple months before, where we were in the 12%, and we saw people really take action, and we got that back down to 5% positivity. So we know that this community can come together and really, move things in a positive direction, where we're seeing the positivity rate go down. So I think it's still too early to say that, hey, we've got this, but it's, hey, we can do this.
Thank you.
And this is Eric at WGLT. A question for Lynn and Colleen. We understand the U.S. government just now starting to distribute a Regeneron, the antibody treatment. I guess it just got emergency use authorization. What plans would you have for that, or is it too early to say? Does that give you some hope that, aside from a vaccine, that this treatment could significantly change prospects for those who have the virus?
Yes, we have made plans, just like with remdesivir, on how we will distribute that treatment. And yes, I mean, any treatment that has shown promise is good news in this, those that are at a higher risk for illness, but the amount is very limited. The amount of people that we can actually get it to, because of the distribution that goes throughout the country, that while we feel good about it, it isn't enough to truly treat everyone that is coming through the doors. So we have set up protocols so that we can make sure those most at risk get and receive the treatment.
And I would just echo what Lynn has said, that the number of doses that are able to be distributed are minimal compared to what the need is out there. We also have criteria in place, and will be set up to start administering this week. But when you look at the number of patients, you could go through that in just a handful of days based on the number of doses that are being allocated. So I think it would be misleading for the community, or provide a false sense of hope that there is this great treatment that's widely available at this point in time.
And this is Eric at WGLT once again. For Lynn and Colleen, can you say how many staff members have tested positive for the virus since this began, and if there are any that have required hospitalization?
No, I actually can't really answer that. To be exact, we've had, I mean, it's probably well been over 15%, if I was going to guess a percentage, at least for the Bloomington Normal area within OSF. And yes, we've had staff throughout our OSF locations who have become ill and had to be hospitalized. And unfortunately, we've had a few pass away in our ministry. And heartbreaking for the caregivers who, as Colleen articulated, become very close. But then when it's one of your own, that's even more painful.
And I believe across our Carl healthcare system, it's about 4% of our workforce that has been impacted in terms of testing positive collectively. And we as well have had several hospitalizations as well.
All right, we do have time for one more question. All right, if there's no other questions, I want to thank Colleen and Lynn for joining us at McLean County Health Department from Carl Broman and OSF. So again, this will be on the McLean County's YouTube page for people to access after the fact. But thank you very much and have a safe and happy holiday. Thank you.
Thank you.
Bye-bye.